Good day. Thank you for joining us here at Capillary Plastic Surgery. I am Dr. Kumanis, and a board-certified plastic surgeon here in upstate New York. And today's topic is gynocomastia, or enlarged breasts in males, in the male population. This sometimes occurs through puberty due to hormonal effects, where the breasts become engorged or enlarged, sometimes equally and sometimes only in one side. And this basically causes discomfort, not only physically when people men are working out or exercising, but also aesthetically, people and psychologically don't like it, or it can be distressful for them, distressing. So a lot of people, men will come in seeking a reduction in it. It usually starts with a physical exam and sometimes blood work to make sure it's not hormonal. But most of the time, gynocomastia, or enlarged breasts in men, is idiopathic, meaning that there is really no serious issue with it. It's just overgrowth on a normal continuum. In fact, meaning that it's pretty frequent. However, men obviously don't like it. It's sometimes teenagers are teased on the school ground or during physical activity, or in the gymnasium or in the showers, and therefore they usually seek us to excise the area. So if it happens in the teen years, sometimes it will go away by the time you're 18 or 19 years old. But sometimes it happens so fast that it's alarming, and the teenage boy will want it removed, and that is totally fine, and that can be done. Sometimes it happens a little later in life, in their 20s and or 30s, and it can happen spontaneously. So how do we perform gynocomastia? Usually the incisions, depending on how much skin envelope there is. If there's a lot of hanging skin, the incisions are larger. But if it's only breast tissue we're taking out, I perform it in a combination of usually some liposuction in the area and a small incision just below the nipple, or actually at the lowest line of the nipple. And then we, under direct vision with a light retractor, we excise or resculpt the chest so it's much more flat by removing that breast tissue on each side, comparing both sides, trying to make them as equal as possible. The surgical scars are usually very well tolerated, and the satisfaction rate is very, very high. There isn't a lot of distress to it. Sometimes you wake up with some drains. You have a wrapping that you have to put up and keep for 2 to 4 weeks. But physical activity is usually started again anywhere between 2 and 4 weeks, including sports. And like I said, most males find this the satisfaction rate very high in this procedure. So if you feel that you may be a candidate or are concerned about this issue of overgrown breast tissue, then call gynocomastia. Please feel free to contact us. We do free consultations here at Capillary Plastic Surgery, and we'd love to talk to you.